Hello, my name is Dr. Shanice L. Higgins. I am the program director here at Kettering College for the Occupational Therapy Doctoral Program. Our program is located at 68 Darst Road in Beaver Creek, Ohio, 45440. We are located within the Ollie Davis Medical Center, and we occupy the second floor. I am now going to take you on a tour of our department. Please join me. So when you enter into our department, this is our lounge area. This is our lobby. Right here we have Miss Pam. She is one of our administrative staff, and she works closely with the faculty and the students to accomplish the different goals that they need to have. We have our printing and copy center in that corner. Over in this corner, we have 2 computers that students are allowed to use for any types of tasks that they need to do related to registering for class, if they need to order books, if they need to log on to the library site, then they've got this space here. We have our mission statement for the program, and our mission is the Occupational Therapy Doctoral Program at Kettering College is committed to developing occupational therapists who are culturally proficient, who demonstrate superior clinical and critical reasoning skills, and are innovative practitioners prepared to answer God's call to Southern Ohio and beyond. Okay, so the next space that we're going to visit is our student lounge. This area of our department has the most light and joy and happiness, I think, for the students that get to come in here. This is kind of a down space for them. This is where lots of meals take place, lots of group meetings take place. As you can see right now, we have a group that is working with one of our faculty members on a project that they have coming up. And so they're able to use this space to get that work done. There's a TV in this space. We have our announcements that scroll across the screen so that students are able to stay up to date on anything that's happening within the program and across the college. This space is designed specifically with the students in mind to allow for them to get the things done that they need to get done when they're here throughout the entire day. Okay, so now I'm going to take you into our musculoskeletal lab. This lab is where students do a lot of things related to kinesiology, neuro, anatomy, and physiology. In this room, we have these special tables. These are called plinth tables. They're padded. These mimic things that you would see in the actual clinical environment, so that if you need to work with a patient on things like range of motion or strengthening or exercises, you've got to have a surface that allows them to be able to be comfortable when you're working with them. And so we have that in the actual classroom space so that students have the opportunity while they are in their didactic program to be comfortable using the equipment that they would be using in the clinical setting. So in this space, within the cabinets, we keep all kinds of equipment and models because these are things that allow the students to learn and practice the skills that they need to do. And it's stocked much like how it would be stocked in the clinic. So we have things like TheraBand, we have paraffin, we have modeling clay, we have Play-Doh, which they use to make different models related to neuroscience and kinesiology. We have dynamometers and pinch grips, so all the kinds of things that you would see within the actual clinic setting that therapists might use to work with their clients or to assess their clients' level of function, we house within the department so that students have the opportunity to get that hands-on skill practice while they're here with us. This space here is our computer lab. This is a lab that is set aside for students. It has several computer monitors that are connected to our intranet here at the college. This allows the students to access things like the online library, again, to access the registrar's office, anything that's related to the college. It's also a quiet space that allows students to come and work in groups, that allows them to come and do testing if they need testing accommodations, or sometimes if they just want to have a quiet space to work, they'll come in here. All right, so this space here is our ADL lab. This is one of the most used and I think one of the most loved spaces, aside from the student lounge, by the students. So in this space, what we have created is a simulation of a studio apartment. This allows the students to be able to practice hands-on skills of working with the client in their home environment, The focus of our program for occupational therapy is to get our patients back to home. So we try to do everything in what's known as an occupation-based framework or lens, which means that while it's important for students to understand how to work in clinical environments like the therapy gym or the hospital room, our goal as occupational therapists is to get patients back to home and back to baseline. And so we have to allow that learning environment as well for students. And so we have created it in simulation here within the department. So what you see right here is to mimic a bedroom. So we have a bed, we have a nightstand, we have a bookshelf, we have a bedside commode that you might commonly find if a person has recently had surgery or an injury and they're not able to get into their bathroom. We have a sink, and then over in the corner we also have a commode and a shower tub setup so that students can practice helping clients get safely into and out of the bathtub or the shower. Next to it, we also have a full-length mirror that you might find within a home environment that also allows for you to work with patients to help teach skills, particularly when they have visual or sensory deficits that maybe are throwing off what they think is happening with their body. Using the mirror allows them to see what's happening in real time with their body. And then next to it, we have a shower that's just a simple walk-in shower, because sometimes, particularly for people who are aging in place, they're moving from a tub shower combo to just a step-in shower, and those typically tend to be more narrow and they have a little ledge. So if you're working with someone who maybe is prone to falls, being able to understand what that space actually looks like as a student so that you can prepare for it when you're out in the clinic is awesome. Over in this corner, we have what would be the kitchen laundry area that you might find in a studio apartment. And so we have a dining space that would mimic what you would have. This is a place, again, that students come and work in groups, but also where we can have them mimic and role play treatment. Within this space, we have a washer and dryer. Both are functional, so that students actually understand the task analysis behind washing and drying clothes and doing laundry. We have a functional sink, stove, microwave, and refrigerator. So again, we keep this space as realistic as possible so that when we come in and do treatment and intervention with students, they're actually doing the occupation and tasks that they would be doing with the patient, so that they understand what that process is like and how they may have to adapt or modify it for their clients.
So this is the room that we use for the lab in the physical agent modalities and orthoses class. Actually, right now the room is set up for physical agent modalities lab. The students today are going to be learning about neuromuscular electrical stimulation. Some of the other things the students have learned in here is they've learned how to use ultrasound, they've learned how to use modalities like heat packs and paraffin baths and fluidotherapy. Later in the semester, the students are going to be learning how to fabricate orthoses. Orthoses, or by the more common name, splints, are usually like thermoplastic braces that occupational therapists will make for their clients to facilitate functional use. And these are some examples of the orthoses that they're going to be making later this semester. So they're made out of a plastic that gets soft at a relatively low temperature. Normally, this device and this device are filled with water that's kept at about 160 degrees, and then they'll use tools like spatulas and scissors to pull the material out of the hot water, and use scissors to cut it to shape, and then they'll mold the orthosis on their client to achieve the desired goal, whether it's to stabilize the wrist, for example, or maybe an orthosis that's intended to just position a hand appropriately while if the client isn't going to be moving for an extended period of time, or maybe something larger. This is an elbow orthosis that's made to stabilize the elbow. It can be molded with the client in a variety of positions depending on what their specific needs are. Or maybe a much smaller orthosis like this orthosis. This is an orthosis that we would fabricate on somebody who has some arthritis in the joint at the base of their thumb to stabilize that joint and facilitate both functional use and hopefully decrease their pain so that they can do more with it.
All right, so this is actually one of the classrooms we use at Ollie Davis. We primarily use it for pediatric intervention courses, or at least it's the designated space for pediatric labs, as well as lecture classes. In this room, we have multiple cabinets in the back that are full of toys and games and various things to support activities of daily living that students get to interact with when they're doing some of our special labs. We also have a hook in the middle that we use to put a swing up. Sometimes we'll use swings in intervention related to balance or postural responses. They talk about using swings sometimes related to sensory integration, and so we'll restage this room either with tables for lecture or bringing them all out and putting up mats to do various intervention practice skills with students.
Hello again. Thank you so much for joining us on this tour today of our facility. I hope that you have found the students welcoming, the environment welcoming. I welcome you. If you have any more questions or would like more information about the Kettering College Occupational Therapy Doctoral Program, I invite you to visit us at www.kc.edu/OTD. There you can find more information about each of our faculty, about the foundations of our program, and information to contact us about applications for admissions. Thank you again. Take care.